My basic take from my Ute, Dr. Adalja, this is all about pediatricians. Can the pediatricians get this done?
I definitely think pediatricians can get this done because pediatricians are used to giving children vaccines all the time. So as we've seen, vaccination rollout move away from mass vaccination centers to doctors' offices, to drugstores. I think that's going to be something that makes it really easy for children to get. And pediatricians are probably the best vaccinators they are. They are very good at reassuring children. They're very good at handling and storing vaccines. So I think this is going to go well.
And within that, and thank you for your optimism, but within that is the idea none of us would go in and tell our pediatrician, no, we're not doing tetanus. No, we're not doing diphtheria. How do we get to that belief with COVID?
Well, I think that people recognize the value of the COVID vaccines. They know that there are going to be some parents that are vaccine hesitant, that are on the fence, but many people want that age group of 12 to 15 vaccinated to be able to facilitate summer camps, to be able to facilitate extracurricular activities at schools, and to remove, one more obstacle that some school boards have put in the way of opening schools full time. So I do think that this is going to be something that you're going to see an initial demand, and then I think we'll get to that kind of point where we have to start talking to people about what the benefits of the vaccine are for their child and kind of weighing the risks and benefits in each individual child. But I think that you're going to see an initial surge of parents wanting to get their children vaccinated.
Doctor, you said a couple of interesting things there. One of them is that people recognize the value of the vaccine. Do you think we've done a good enough job in government, from the CDC, etc., to communicate the value of taking this vaccine, of receiving this vaccine?
Not completely, no. And I think we're only starting to get that way. The CDC guidance has been very cautious, little baby steps. It's been lagging what people have been doing. And people keep saying nothing changes when you get the vaccine. And that's not the message that's actually true. And it's not the message that people want to hear. I think that in the early adopters, the people who get the vaccine first, those first groups of parents, they're going to understand that value. But when we get into the general population, you may find people saying, well, why should I get this vaccine? It's not really a value. I can't really do anything. And that's why we need the CDC to be more proactive and really pushing the envelope of what vaccinated people can do, because the virus treats you very differently if you're a vaccinated person. So other people should treat you differently because you're no longer a threat.
Do you think we've moved the goalpost just a little bit here over the last year? At the beginning, a lot of people felt like that it was about protecting, almost exclusively about protecting the most vulnerable in society. If the overwhelming majority of that group is now being vaccinated, Doctor, there are some people asking the question, why are we still doing all of this?
I think that's a great question, because that's what flattening the curve was all about. It was trying to keep cases below hospital capacity. And that's exactly what the prioritization scheme did. It vaccinated nursing home residents, high-risk community-dwelling people, those who made up the majority of hospitalized patients. And now if you walk through a hospital, it's nothing like it was just in January of 2021 because so many of those people have been vaccinated. So I do think we have been successful at taming this virus. We've been successful at defanging it and removing the of it cause hospitalization, serious deaths, serious cases or deaths at the rate that it could in the past.
I look at the cases rolling over. When does a pro like you say we're all clear on cases? Is it a 20,000 statistic? Is it 5,000? Or do we literally need to go to zero?
It's impossible to go to zero. This is not a virus that can be eliminated or eradicated. I don't know where that number is, whether it's 20,000, whether it's 10,000. To me, it's always been about removing the ability of this virus to threaten hospitals. And we've largely done that in the United States. So to me, I think the pandemic's acute phase is over. Now this is sort of mopping up, trying to decide what level can we live with, what level of disruption can people have when they've got cases and exposures. I think we need to get as high a vaccination percentage as we can. But I do think right now we've done the primary objective, which was to protect our hospitals from ever being inundated with COVID-19 patients the way they were in the past.
Doctor, in your opinion, at this stage then, do you think it would be more effective to lead with a carrot and not a stick?
I think it's always better to lead with the carrot and not a stick from the very beginning. We know that from many other infectious diseases, that abstinence-only approaches with HIV, sexually transmitted infections, injection drug use, it doesn't work. We have to do harm reduction. We have to tell people these are the risks. This is a toolkit that you have that you can use to decrease that risk, knowing you can't get the risk to zero. I think if we would have done that from the beginning, we would have avoided all the acrimony over masks and politicization that happened. And I think we definitely need to do it now as we're moving into this next phase.